Is there any possibility that the staff opening of the PJA may be delayed if the border jumper situation, those who are positive for COVID-19, changes drastically in terms of increased cases?
Well, yeah, I mean, anything can change. And even that's why the tourist situation may be a more controlled setting than any potential outbreak you have, because even if a tourist comes to that structured layer or corridor, if you will, then you will know where your contact tracing is going to be. We don't know what happens with illegal. I mean, this cluster right now, I don't know how widespread that is in a given community.
At what point does it become too much for the Ministry of Health to deal with COVID-19 cases?
Well, that's a difficult question because it will depend more, not necessarily on total number of cases, but it depends more on the severity of the cases. That is what can overwhelm your hospital setting.
Penalties for tourists.
I hope that there are stiff penalties. We have made that recommendation and hope that it's established by the Surgeon's office. But not only for tourists, I think Belizeans who don't keep the quarantine, there must be stiffer penalties.
Well, would you agree that tourists would resist that kind of oversight?
Stiff penalties.
But they would resist, meaning that they're here for vacation, so they don't want to be, eyes looking over their shoulders. They want their...
Well, that needs to be said before they get here. And at the end of the day, the public health of the people of this country shall or should be the basic factor that trumps everything else that happens after that.